Hello, guys. So, today in this podcast of Brew with Bones, this is another session of Meet the Mentors. Here we have Dr. Fu Yuen Thong from Malaysia. He's a consultant foot and ankle surgeon at Sabah, Malaysia, and he's also the AO Education Officer for Malaysia. He also holds multiple positions in other organizations like Fracture Fragility Network. We are very happy to have him. He is here to share with us the pathways of getting into Malaysia, to get trained there, and even to immigrate there. Looking forward to your answers.
Okay, thank you guys. Thank you.
Can you give a brief introduction about yourself and the type of practice that you have in Malaysia?
Okay, first of all, I want to say thank you to Groovy Bones, Giri, and Satish. Thank you for having me in this massive project of yours. Let me say I'm a big fan, and I still read your newsletters. So keep up the good work, and that's yeah. I think you get that a lot, so I just want to get it out of the way. I'm honored. So now we move on. So you were saying that how Giri, you were saying that how does the practice work here in Malaysia?
In Malaysia, yes.
Yeah.
In Malaysia. Yeah. So like training wise, I think pretty much standard. Go through 5 years of medical school. Everything is we pass and stuff. And then we take another 2 more years to practice and all that. Practice. And then we will apply for our master's program, our postgraduate program. That will take another 4 years.
Mhm.
And after which we graduate to become a specialist.
Okay.
Okay. Yeah, services here are generally government based. We do not subscribe to like the healthcare models that other countries where the surgeons go work in both private and government. If you're government, you stay in government, and then if you're private, you stay in private. We have no official healthcare insurance for the people yet. So yeah, so the government hospitals will be our citizens will be covered by government hospitals up to a certain point, and those who can afford it or those who have insurance, they will opt for the private centers. Right.
So
Okay.
it's totally the insurance cover is totally individualized, and if you have a private cover, you can get private services.
Yeah, yeah. That's how things are maybe different between Malaysia and other countries like Indonesia, India, I think. Of course, places like Taiwan and some of the countries I visited is different. The healthcare model is a bit different. And then but the quality we hope that it matches up, right? It
Okay.
matches. Yeah.
So post the med school, those 2 years is mandatory.
Sorry?
Post med school of 5 years, you said you had to practice for 2 years. So is it mandatory in the system?
Yeah, it's mandatory in our system whereby after medical school we go through what we call housemanship. Then where we go through rotations of postings and all that, and after 2 years you get gazetted as a real functioning medical doctor. So the first 2 years you're basically at my time we were given the job, but we do not rise up in we are not allowed to apply for masters until at least 2 years after you finish medical school, right? So sometimes the process of application based on your credentials, based on your exams that you have passed and all that, that might delay your entry into the postgraduate program.
Okay. So after the master's program, so how do you get placed? Either it's a government or a private setup.
Yeah, I would say most people go through the masters via the government route, because when we go into the master's program via the government route, we get like support. We officially given leave with pay. So what happens is that we go through the master's program. No fee is included. No, there's no fee. But we after graduating, will be bonded to the government. So we serve the government for a compulsory number of years, kind of thing. We rarely get private candidates into master's program. Only recently they have.
It's mostly like the
normal,
Indian system. Mostly like the Indian system.
correct. But recently they have opened up a bit more leeway where certain people who have left the government system and fully employed by private, they will pay like a higher fee, a much higher fee to go into the master system to get recognized as a specialist, right? So that will mean that and that's why I was very clear. We have two particular tracks. Most of us are government, and then you go through the master's program, And after the after the master's program, then there will be another 2 years of gazettement, 2 years gazettement period to make sure that you're okay, and then you get yourself into this national specialist registry. And once you got that, that's when you are officially a specialist, and then you can go do your private work and stuff officially.
Okay.
Right, because you have to get the license to call yourself a specialist. In fact, later on, I think we will talk about if there are any people who are trained overseas, expats, so on and so forth. That is the major hurdle you need to get. Somehow you need to get yourself into the national specialist registry, and then you can practice as a specialist.
Candidate who is under the government route enters a government hospital, is he allowed to practice in private?
It depends on what capacity, right? You won't be allowed for up until you get your specialist registry. You probably will not be allowed to do any specialist work. You will probably be doing resident work, just seeing patients, clinic work, stuff like that. But generally, operating wise and all that, it's not really encouraged because you're not really gazetted yet. And if anything happens, legally, there's nothing to protect you.
Okay.
Yeah.
So after the residency, how does the fellowship work? Like after the residency, you should do a mandatory government service and then go into fellowships, or how does it work?
Yeah, thanks for the question, Giri. It's the same as well. I think of it this way. I'm not sure about India, but think of it this way. They're trying to maintain the talent pool as long as possible. You will have to go through another 2 years of examination process and all that to be even considered to be eligible to apply for subspecialty training. The Malaysian subspecialty system is a bit special. We have a how do I say this? We have a Ministry of Health recognized version of the subspecialty training program. It's actually 3 years. It's not the 6-month thing that most countries do. It's a long time. My friends overseas always say that's a bit overkill. Either that or we are very well trained subspecialty. We give it that regards to our subspecialty, because most places is 6 months, right? You go to 6 months, there are people, probably you edit this later, but there are people who go out for 2 weeks and come back and say they are subspecialty trained. Our program is 3 years, and with the same logic, you are given leave from government work, from Ministry of Health work, to go and learn and go and attach yourself to certain places to do. So there are a few trainers and all that. So right now I'm a trainer, for example, and I have 2 fellows under me. So they come from around Malaysia to come and train under me. So the 3-year program means that you get paid. Giri will know this, where you go overseas 6 months, you might not get paid, so on and so forth. But this is a 3-year thing where you get paid. Your government salary still runs, although without some allowances because you're not there. You are in another hospital. Your government salary runs. You go 2 years, 2 years in the locals, 2 years locally, and the option of the 3rd year going overseas.
Okay.
Yeah, and that is also again partially funded, or you get a scholarship to go overseas as well. Again, after that, then you get bonded. There's a certain amount or number of years of bond, that kind of thing.
Okay.
Yeah, because we have not really resolved the issue regarding subspecialty.
It's like another residency. Like we go through another 3 years, right?
Correct. The only issue now, I'm sure they have it in your country as well, in most countries as well, is how do we deal with the ones who are trained 3 years versus the 5 years ago who finished 6 months. So you calling yourself a sub, I'm calling myself a sub, but I went through 3 years. How can you get by so easy, ding dong? So that has not been resolved yet, actually.
Yeah.
You don't have a subspecialty register as of now. National subspecialty registry.
For other specialties, yes. But there are a lot of other for other specialties, yes. But there are also a lot of specialties which are still a bit behind. For example, let's say we take general surgical. Vascular is established. There's a vascular registry. But let's say like anesthesia, they only subspecialize. They only have apparently the anesthetist and the intensivist, and that's it. So all the the small ones in between, the pediatric, the cardiac anesthetist and all that, they are really haven't been like listed yet. I think everybody's still working on it. I guess the subspecialty thingy here is relatively young compared to you guys. You guys are much more established with much more surgeons and stuff. So yeah.
But still,
So
even
I
we
think
don't have a subspecialty register yet.
Oh, okay, that would probably be because there's too many of your too many surgeons. Then it's because the discussion will be worse. Like, oh, I how can if you can allow under the grandfather rules, the somebody who was practicing for 10 years is considered a sub. I'm only 1 year shy. I'm practicing 9 years. Why I can't go in? Then ding dong, Then that's where the disagreement comes, I guess. So there are more voices there, more disagreement. But I think that's the same everywhere.
In India, it's not very structured like Malaysia. We have some 3-year programs in central institutes coming up, but they are still at a very early stage. As of now, like you tell, people here get trained for 3 months, 6 months, even 1 month. Some people get trained for 2 years. We have a national fellowship program for 2 years, but that has very limited seats, and some people think 2 years is too long.
Yep.
So in India, it's all varied. It all depends upon the skill set you have and how public trusts you. There is no centralized subspecialty registry or recognition as of now, and there is no legal compulsion also.
Maybe down the line we might get some regulations to call yourself as a specialist, subspecialist.
Yeah, I think that's the way forward. I'm proud that I actually know some of the guys who had the vision. I actually work with some people I know, actually in AO as well, where AO Malaysia as well, where I think they designed the program. I think it's very good. Although, like you say, some people think 3 years is long, but I think it's really structured, and it helps a lot of people like me who wouldn't be able to afford to go out and learn for 6 months or 1 year, or let alone 2-3 years, and see different places and how they function. And I feel like speaking to Giri, if I were just locally trained, not to say that we don't have good surgeons, I would say that my confidence level and how I learn to deal with people, right? It's a cultural exchange thing as well, right? By speaking to more people, learning from more people, you actually gain confidence, and you are more, I don't know, if I hang out with you guys more, maybe I'll become more innovative. I do not know. But it basically unlocks something, right? I think that kind of benefit you cannot predict. But I think the structure is good actually, yeah. So yeah.
So how are the opportunities for international graduates if they wish to come and get trained under you or some other mentors in Malaysia, completing residency in country India? Is it possible? What is the route?
Okay. I guess well, it is possible. Back when I was in my postgraduate programs, I know for a fact that the universities and all that actually do offer fellowship programs. We have big names here as well. My former university, where I did my postgraduate programs, in orthopedics, she had fellows all the way from was it India, Africa, and all that. They come for peace, they come for spine, so there are ways to come in and do fellowships, right? Recently, and not just one, we have a lot of centers that actually have the local university to actually do accept fellows. But I'm not sure how is it in India. Because like my experience is certain times I go to universities, like I went to Chiang Mai for an attachment, I went to University of Basel for an attachment. They were nice and welcoming. But there was no fee involved. Right? I'm not sure about in India, but I know that if you were to come here, even in the local universities, there will probably be a fee for the fellows. You have to pay a certain amount, which I'm not really sure. So yeah, I'm not sure whether it is by the discretion of the university or the department. I did bring it up to my Thai prof when I did my fellowship, and he was like, "Oh, for education, we are usually fine with that kind of thing."
So is the fee only for the international candidates, or is it also the same for the local candidates?
It is only for the international candidates. Remember, I guess also for local, because remember I said that we get a scholarship from government, right? So I guess that fee goes there.
Okay.
right? That's why we are bonded. But as a government servant, when we go through the program, that's why we are bonded, because we don't pay a single thing. So, so if you're coming for international without the bond, I guess then the fee applies. The fee
Okay.
applies, right?
So,
Then of course, then you get you come with the cert and all that. I was sharing with Giri during one of our chats that recently some private hospitals have started allowing fellows or encouraging advertising that they are allowing fellowships with their surgeons as well, right? These are good guys. These are strong. So I guess they are confident that it's because a lot of these private centers now are coming up and setting up their own training centers and universities and all that as well. Okay, there's a very famous group of hospitals here which have their own universities. Right? I'm
oh,
sure India has it as well, right? So for them it's an easy transition. I have a university training medical students maybe, or I have a hospital and now I can start training surgeons and all that. So I feel that the definitely an option. I think that's a very long answer to Giri's question. Yes, there are opportunities available for specialty training, for subspecialty training, and for specialty training and even subspecialty training.
okay.
Yeah.
So we understand that there is a fee, and how does it work on a monthly basis? Are we paid any stipend monthly, to be there, or
Mm.
we won't be paid anything? How is it?
And should
Yeah.
we take care of our accommodation and food, or will it be provided?
Okay. Yeah, I think that depends on the arrangement with the university or the center that you're going to. I mean, you guys have been to fellowships as well. I think they won't guarantee you upfront, and I don't want to oversell and say everything will be provided as well. But I think it's safe to assume that at best, the universities can provide you with accommodation, but you probably will be paying for it anyway. Again, I'm not really sure how the system is, but from my interaction with some of the fellows that I did meet from overseas, they are not paid a stipend because they're
Okay.
there to learn, and they're there to learn subspecialty and all that. They probably can assist, and if they are granted the rights to operate and assist the surgery and stuff, but they are still under training. So again, remember the whole national specialist registry thing, that you're not gazetted to cut. So I think getting paid for it is a bit less likely. But of course, yeah, maybe things will be different, or things are different now. I'm not sure. Yeah.
Okay.
So
So,
that brings us to the next question. How are the cutting chances, and are we allowed to participate in the surgery during the fellowship there?
Yeah, it depends again on the center. But there are chances. Probably you would most probably won't be lead surgeon when you come.
Yeah.
But assisting and all that is definitely allowed. Yeah,
Okay.
it's not just a pure observership. You stand at the back while the surgeon cuts and all that. The centers that I've been to, they are more than happy to welcome the surgeons to be there during the surgery as well.
Hmm.
Yeah. But the big names that you guys come for, they probably have a lot of fellows as well. So the who stands in
Crowded.
front is like is the other issue. Yeah. So
okay.
yeah.
So the fellowship with the private in hospitals will be different, and the fellowship with the public hospitals will be different, as I understand. Is it?
Yeah, I suppose so. I think the fee will be different as well. But I'm not really sure because I haven't really met anyone who has been to the private ones yet. They're just recently or maybe over the past few years they have only started to promote it. So I'm not really sure.
So how do we apply to this? Is there a centralized application system, or is Malaysian Orthopaedic Association coordinating this?
Oh, okay. That's a good question, actually. I think that's a question that a lot of people ask. Unlike Australia and India, I think we don't really have a centralized database with a registration process. So you just write into the universities or the private center directly and say that you are interested in the fellowship program, whether it's offered or not. My advice is normally to approach the surgeon and the big name that you want to go to, and then see whether their center allows it. right? Because there are people that I know want to get themselves attached to specific surgeons in even in a government hospital, and that hospital allowed for it. I'm not sure whether it came from a teaching hospital from the other end, whether there was an exchange program, but it is hopeful. It is hopeful. So the best thing is to write if in doubt. Like if I want to go under Giri or Satish, I'll write to you, and then I hope that something can happen. There's always the first one. There can always be the first fellow, that came from Malaysia to under Satish or Giri, right? So you just have to start, and then whoever applies will be to set the template of how things can run after this, right?
Okay.